So you've just trained in EMDR therapy and you're now asking yourself, how can you identify a suitable case? This is a great question. It's the correct question because at the heart of EMDR is a trauma-informed way of understanding your caseload. What this means is that you look at the cases that you already have in your caseload, but you do so through the lens of trauma. So for example, Katie O'Shea talks about trauma or defines it as any threat for which the mind is not adequately prepared. Ultimately, what we're being guided by is how the person feels, which is why I always teach the adage, you've got to feel to heal. So feeling to heal means that the person can identify and connect to the emotional tone related to the memory network that they're working on. And the next thing that we're going to look at is, can the person stay within their window of tolerance? The work of people like Peter Levine and Pat Ogden and the like. If a person can stay within that window of tolerance, if they can feel the feeling and stay with it and identify a memory network that's related to it, well then we're pretty much ready to work on the traumatic target. You want to do a good history and assessment just to make sure that there are no other emotional landmines there, other trauma networks that could erupt into the session. And so that's going to require a good history taking. And I normally recommend that people complete a number of set scales. So first of all, getting a rough guide to how dissociative the person may be, complete the dissociative experiences scale. The second version gives you a nice gauge to see how dissociative an individual is. And if they're very dissociative, you may, in your early stages of learning EMDR, want to step back from that type of case, unless you're very highly experienced working with dissociation. That's the other thing. Stay within your caseload. Stay with the cases that you're experienced in. Just because you've trained in EMDR does not now mean that you can work in clinical areas outside of the area that you're normally qualified and prepared and supervised to work within. So stay within your own area of expertise. And lastly, working with an individual on targets that they want to work on. So we can sometimes identify traumatic targets, but a person will say, I do not want to work on those. So understanding how a person is presenting, where's the ouch, what is the emotional tone, and can they safely contain that? How well resourced are they, and are they willing to work on it? I think are good questions to start with, and how to identify whether you can work with this particular patient with EMDR.